Thank you very much, Thank you very much, Ms. Teresa. Our next presenter is Farid. She's a general surgeon and AI and XR strategist at Munfarid Consulting.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Thank you all for attending. So healthcare is one of the most influenced fields by technologies like augmented reality and artificial intelligence, where their involvement brings improvement in current procedures and further opens new avenues for new techniques. If we talk about immersive technologies, collectively immersive technologies refers to technologies which are we able to interact with more with the digital world in our existing reality, such as augmented reality, virtual reality, or the metaverse. When we are working with immersive technologies, learners are better able to understand tasks and perform better in real life with multiple practices. Immersive technologies help us to reach patients in far-fetched places, so doctors and nurses can cure more patients. Furthermore, immersive technologies are making waves in the way treatment is being delivered. The reality is that we are still in very early days for immersive technologies, despite the hype and the terminologies that are trending in today's time. However, we are still in the early days. But still, even even in the early days, no technology even came close to an impact compared to immersive technologies. As a general surgeon, my initial steps in using immersive technology in my practice rose from the needs of my own patients. And then with the help of my seniors and encouragement from them and with the right ecosystem, we were able to conduct our first and the region's first therapeutic virtual reality experiences. So the first program I initiated was using virtual reality as a distraction therapy for children undergoing cancer therapy. This program was a hope for them to look forward actually to their next chemotherapy session. Instead of being in a confined, daunting chemotherapy suite, now, thanks to technology, they were escaped and teleported to an interactive and immersive environment. This environment could be a journey, it could be a play game, or it could be an interaction or a collaboration with their friends. The response of this was very overwhelming, which encouraged us to further extend the program, and now we were using virtual reality as a distraction therapy for children undergoing anesthesia, undergoing cast removal or application, and even during blood withdrawals. All of these examples are very, very simple procedures, but the noise created behind them is massive. And we found many ways to avoid and make the whole experience, one, painless. Secondly, we make the children getting used to it and looking forward for the next experience. Using simple technologies and simple tools did not only impact our patients, but it further spread positivity in their families, friends, and they helped us to further spread the word of innovation forward, so that our institute or our facility or myself as a doctor would be known as a doctor who would be using innovation. These are some of the first steps for any innovation to take place in the healthcare industry. Despite living in exponential times in terms of technology and ICT, the implementation and adaptation of innovation in healthcare is still facing a slower path because of the protocols and the regulation that We cannot escape. We need to match with the times and learn how to make it more easier. So innovators around the world are making content in immersive technologies. Whether students from many leading universities are learning entire human anatomy using virtual or augmented reality. Nursing students, paramedic students, and even pharmaceutical education is being delivered using smart devices. The outcome of which is that we're able to train more and more doctors in lesser time and train even more healthcare providers in lesser time and with better skills. A virtual environment or a medical metaverse is a safe space where the healthcare provider are able to practice multiple times and they're even free to make mistakes, all the way to making an injury or a wrong incision or even killing a patient for the purpose of learning. This activity builds their muscle memory and makes them to be better prepared for the real-life emergency. In the UAE back in 2020, we created a large-scale program to teach healthcare providers on how to use ventilators effectively with the rise of the COVID-19 crisis. Universities around the world, not only in healthcare but other subjects as well, have come to a conclusion that using immersive technology compared to conventional method able to lead to fewer errors to up to 100 times. Using immersive technology also leads to knowledge retention to more than 3 times compared to a classroom training or any other conventional method. So if the technology is so promising, then how can we help Institute to get along better? So this is how I got excited to create an unrivaled XR implementation program to help other institutes also to get along the journey. These are some of the 6 top questions institutes or universities or hospitals can ask themselves before getting into the journey or even before exploring to work with a content provider or a hardware provider. There are many best practices that can be implemented, and institutes must reach the right consultant for the job. A person who understands the healthcare industry and their challenges, understands the perspective from the healthcare provider, from the patient, and the entire ecosystem. The entire ecosystem does not only include the healthcare provider and the patient, it also includes the patient and their families, and it also includes the management of the hospital. And unrivaled programs takes into consideration a perfect match between the hardware, between the content, the level of engagement, and the human factor in it. So when you apply an unrivaled XR program, you are taking a program approach to implement hardware that is compatible with the end user. We are still learning about all of this. Not all hardware would be compatible with every age group. And likewise, what will the institute do in case they have invested in a certain hardware and a newer version is coming in 6 months or 1 year time, which is the actual scenario in current times. Technology is growing exponentially and very much faster compared to the adaptation that is happening. So a match is needed between both of them. Then whenever we're implementing technology, especially immersive technology, we need to understand the culture, the languages, the environment, and what needs to be done step by step. An immersive program is a program that is targeting empowerment of every stakeholder in the game. The higher management, the C-level of the institute or the hospital need to make use of this platform or this program to attract more and more business for them. The healthcare providers need to use this program and feel empowered by them and be able to help more and more patients. And also come up with research and studies using these technologies. Furthermore, the patient and their families must feel empowered and must be engaging in the game. So I truly believe that in the growing times of technology, healthcare workers, if they don't initiate, at least they need to have the good knowledge and the precise knowledge about innovation and technologies. This will help them to be better prepared for whatever is coming, and whenever they will be meeting innovation, they will know the right questions to be asking. Overall, in healthcare, as healthcare provider myself, the prime goal of digital health and innovation in healthcare is to enable us to be able to reach more people and everywhere. We should be able to use the technologies that are available today, to use intelligent connectivity to reach to far-fetched areas, and to be able to solve pain problems even without the physical barriers and the language barriers. Thank you for attending.